Hey guys, it's Dr. Kresimir here. I am sitting far too close to the camera to begin with. I'm a chiropractor here in London, Ontario, and today we're going to be talking about a really important distinction in your life, which is the difference between getting out of pain and fixing the underlying problem. So I have an x-ray here. Well, here, let me show you. So this is a gentleman and I'm going to try my best to show this. So this is a gentleman that came here to see us. There's a couple things that really stand out. Number one, make sure I'm on the right side. This sacroiliac joint here is fused, and you can see that he's had hip surgery, so there is a lot of hardware in his hip, 7 or 8 screws that got put in there. Understandably, he's in a lot of pain. His body has degenerated. It's not moving well. And the conversation that I want you to understand, and I want you to understand it because it will help you make better decisions for yourself. There's a vast difference between getting out of pain and fixing the underlying problem. Getting out of pain can be a chemical solution. They make drugs, they make medications that can help with pain relief, but being pain-free or being in a reduced pain state does not mean that the underlying problem causing the pain in the first place has changed. When it's a physical problem, like the one that I just showed you, medication is incapable of fixing a physical problem because it's not a physical thing, in the sense that it doesn't work on the physical mechanisms of your body. It works on the chemical mechanisms. I'm not here to judge the strategies and tell you, especially with medication, because it's not in my scope of practice, what you should or you shouldn't do, but I am here to tell you that you can alter the way that you perceive pain and the way that you feel pain while not changing the underlying problem. And it's really important to understand because oftentimes there's many of, maybe you don't want to take any type of chemical alteration, maybe you do, but oftentimes with a lot of problems, there's 2 strategies that you need to think about. The first one, again, is what's causing the underlying problem and how do we solve that problem, that's where someone like myself can come into play. And the other one is pain management. Now, of course, sometimes coming to see a chiropractor can help with pain management, especially if we're fixing the underlying structures, your body can heal and recover better and you have less pain. But oftentimes, like this person, I don't necessarily think that it is possible in this case to fix the underlying structures because there's been surgery and there's been actual fusions. The point from this video, and it was clear to me this morning, is that there's 2 questions that you need to ask yourself. And the first one is, am I interested to just be getting out of pain, or am I looking to fix the underlying problem and get out of pain? And once you know the answer to those 2 questions, they will help guide what it is that you are looking to do. I hope that helps. I hope that helps bring some clarity to your life. Have a great week. I'll talk to you next time.